10 early signs of multiple sclerosis in women. Multiple sclerosis, MS, is a chronic and often disabling disease of the central nervous system, CNS, that affects the brain and spinal cord. Characterized by the destruction of myelin, the protective sheath surrounding nerve fibers, MS disrupts the normal flow of electrical impulses along the nerves. This disruption leads to a wide range of symptoms, which can vary greatly from person to person and may include issues with motor function, sensation, and cognition. The exact cause of MS remains unclear, but it is thought to involve an autoimmune response where the body's immune system mistakenly attacks its own tissues. The disease typically presents in episodes of worsening symptoms, known as relapses, followed by periods of partial or complete recovery or remission. The progressive nature of MS can lead to increasing disability over time, significantly impacting an individual's daily life and overall quality of life. Understanding the diverse symptoms and challenges associated with MS is crucial for effective management and support for those affected by the disease. Just a quick reminder, we are not doctors, and the information provided in this video should not be considered as medical advice. This video is intended for informational purposes only. Now let's dive into these signs. Number 1. Fatigue. Fatigue in multiple sclerosis, MS, is a debilitating symptom that profoundly differs from ordinary tiredness. This type of fatigue, sometimes referred to as MS fatigue, is often overwhelming and feels disproportionate to the level of activity undertaken. It can persist even after a full night's sleep or minimal physical exertion, leading to a chronic and persistent exhaustion that affects both cognitive functions and physical capabilities. This type of fatigue is not simply the result of physical exertion or lack of sleep, but is rooted in the disease's impact on the nervous system. It can severely impair an individual's ability to perform daily tasks and maintain normal functioning. Unlike general tiredness, MS-related fatigue may not be alleviated by rest or relaxation and can be further compounded by other symptoms such as sleep disturbances, depression, or stress. This type of fatigue often disrupts the individual's ability to concentrate, process information, and perform everyday activities, making routine tasks like work, social engagements, and personal care particularly challenging. Number 2. Numbness or tingling. Numbness or tingling, medically known as paresthesia, is a symptom often experienced by individuals with MS. It typically presents as an abnormal sensation in the skin, which can start as a light, prickling feeling and escalate to a more pronounced numbness or complete loss of sensation. This symptom usually affects extremities such as the hands, feet, or limbs and can be intermittent, coming and going, or it may be persistent over time. In the context of MS, these sensations arise due to the demyelination of nerves, where the myelin sheath surrounding the nerves is damaged, disrupting the normal transmission of sensory signals from the periphery to the central nervous system. This disruption leads to the abnormal sensations experienced. The intensity of these sensations can vary greatly from person to person, and they may sometimes be accompanied by other symptoms such as weakness or pain. Numbness or tingling can be distressing and might mimic other medical conditions such as peripheral neuropathy, vitamin deficiencies, or circulatory problems. Accurate diagnosis and differentiation from other causes are crucial. Number 3. Vision problems. Vision problems are a common and often early sign of MS, with symptoms varying widely among individuals. Common vision issues associated with MS include optic neuritis, which involves inflammation of the optic nerve leading to symptoms such as vision loss or blurred vision in one eye, and may also cause pain when the eye is moved. Another common issue is diplopia, or double vision, which results from impaired coordination of the eye muscles, leading to the perception of two images instead of one. Color vision changes can also occur, where individuals may experience altered perception of colors or difficulty distinguishing between similar hues. These vision disturbances are typically the result of lesions affecting the optic nerves or brain regions responsible for processing visual information. Such disturbances can significantly impact daily life, making tasks requiring clear vision, such as reading, driving, or recognizing faces more difficult. Prompt evaluation by an ophthalmologist or neurologist is essential to manage these symptoms effectively and to prevent further vision impairment. Treatment may involve corticosteroids to reduce inflammation, vision therapy, or other interventions depending on the specific nature and severity of the vision problems. Number 4. Weakness. Weakness in MS is characterized by a decrease in muscle strength that can affect one side of the body or specific limbs. This weakness can lead to significant difficulties with tasks requiring fine motor skills such as writing or buttoning a shirt, as well as gross motor functions like lifting objects, walking, or climbing stairs. This weakness may be accompanied by additional symptoms such as spasticity, which involves muscle stiffness and involuntary muscle contractions, and tremors, which can further complicate mobility and balance. These symptoms can lead to difficulties with balance and maintaining posture, increasing the risk of falls and injury. Unlike weakness associated with other conditions, MS-related weakness can fluctuate, with symptoms potentially worsening during disease relapses and improving during periods of remission. The impact on daily life can be profound, affecting an individual's ability to perform routine activities and maintain independence. Physical therapy and rehabilitation are often integral components of managing weakness in MS, helping individuals improve muscle strength, coordination, and overall functional ability. Before we move on to the next sign, I want to remind you to hit the subscribe and like buttons if you haven't already. Your support is essential in helping us continue to create valuable content for you. Number 5. Muscle spasms and stiffness. Muscle spasms and stiffness, also known as spasticity, can range from mild discomfort to severe debilitating symptoms. Spasticity in MS results from the disruption of nerve signals that control muscle movements, leading to increased muscle tone and involuntary muscle contractions. This symptom commonly affects the legs, but can also involve other parts of the body, including the arms, back, and neck. The increased muscle tone can lead to discomfort, pain, and restricted movement, making it difficult to perform everyday activities such as walking, dressing, or bathing. In severe cases, muscle spasms can lead to uncontrollable movements and significant functional impairment. Effective management of spasticity often involves a combination of medication, physical therapy, and sometimes Botox injections to reduce muscle tone and improve mobility. Physical therapy can include stretching exercises and strengthening routines to improve range of motion and reduce muscle stiffness. Stretching exercises and muscle relaxants can also help alleviate the severity of spasms and improve overall comfort and functionality. Number 6. Balance problems. Balance problems in MS result from the disease's impact on the brain and spinal cord, which affects coordination and equilibrium. These problems can manifest as unsteadiness, dizziness, or a sensation of spinning, known as vertigo. Balance issues may be exacerbated by muscle weakness, sensory disturbances, or changes in vision, leading to difficulties walking in a straight line, frequent stumbling, or an increased risk of falls. The impact on balance and coordination can significantly affect an individual's ability to perform everyday tasks safely and independently. To enhance stability and prevent falls, assistive devices such as canes or walkers may be necessary. Number 7. Torso tightness. The sensation of a tight band or belt around the torso, often referred to as the MS hug, is caused by nerve damage in the thoracic spinal cord. This sensation can be quite distressing, creating discomfort or pain that may interfere with breathing and movement. The MS hug may cause a feeling of pressure or constriction around the chest or abdomen and can vary in intensity from a mild sensation to severe pain. It may be intermittent, coming and going, or persistent over time. The intensity and duration of the MS hug can vary greatly from person to person, and the experience can be distressing and impact an individual's daily activities and quality of life. Number 8. Pain. Pain associated with MS is a recognized symptom and can manifest in various forms, including neuropathic pain, muscle pain, and chronic pain. Neuropathic pain, resulting from nerve damage, can present as burning, stabbing, or electric shock-like sensations. Muscle pain may occur due to spasticity or muscle tension, leading to discomfort in affected areas. Chronic pain is persistent discomfort that is not always linked to specific activities or injuries and can significantly affect daily activities and overall quality of life. Managing pain effectively often requires a comprehensive approach, including medications such as analgesics or antispastic agents, physical therapy to address pain and improve functional outcomes, and alternative therapies like acupuncture or cognitive behavioral therapy. Number 9. Bladder issues. Bladder issues in MS can present in various ways, including increased frequency of urination, a sudden and compelling urge to urinate, and difficulty starting urination or feeling of incomplete bladder emptying. These symptoms result from nerve damage affecting the bladder's ability to store and release urine properly. The impact of these bladder issues can lead to discomfort, increased risk of urinary tract infections, and a negative effect on social and daily activities. Number 10. Sensitivity to temperature changes. Many individuals with MS find that exposure to heat, such as from hot weather, hot showers, or vigorous exercise, can temporarily worsen their symptoms. This phenomenon, known as Uthoff's phenomenon, occurs because elevated body temperature can slow down or block nerve signals in the damaged nerves. Symptoms might include increased fatigue, blurred vision, or difficulty with balance and coordination. Conversely, cold temperatures can also trigger muscle stiffness and spasms. Managing temperature sensitivity involves staying cool with air conditioning, wearing lightweight clothing, and avoiding overly hot or cold environments. Remember, we're not medical professionals, and the information shared here should not be taken as medical advice. This video is solely for informational purposes. We hope you found this video informative. Discover more captivating health and wellness content by subscribing to our channel and exploring our other engaging videos.